Hi, everyone. Welcome back. This is Dr. Susan Brown, and we're back once again with the questions and answers. We were doing this for some time, having a great time with it, but took a little break, and now we're back, and it's really fascinating. You have been asking many interesting questions. I'm going to answer these questions. We're going to try to be a little bit regular with the question and answers this summer, so we can all kind of learn more about how to take charge of our bone health so we can all each put ourselves in the driver's seat. So the first question that I have is from one of our clients or one of the audience who asks, I saw an endocrinologist after a poor DEXA exam. He gave me no answers, blamed the generic, and I presume she means a generic drug, and wrote a script for Evenity. I'm still searching for the answers as this doesn't happen in 1 year. So meds with side effects are not my route. So she's looking to understand what happened with her bone health and kind of overwhelmed or discouraged that the doctor just told her to take drugs. So let's start right from the beginning. And I'm going to use this little illustration. I love this Newton's cradle. And this Newton cradle shows us a very important principle. That is, what would the energy we put in is related to the result we get out. Like you take this cradle. If I hit one ball, I give one ball of energy and one ball comes out. Really kind of interesting. Sort of like the law of karma. If I take two balls and I hit with two balls, force of two balls, two come out every single time. Now, the point of that is this individual who wrote has fairly serious bone health concern. We'd say her doctor says she should use a very strong, very new, really kind of experimental drug in my mind. And she wants to know an answer. Well, the answer quite simply is no one cares about your bone health as much as you do. If you want the best possible outcome, you should consider taking charge and understanding what has happened with your bone health, what's happening now, what your real risk of fracture is, and what you can do naturally to enhance your bone health. And in addition, if you want, you can learn very carefully about the bone drugs. And of course, as you all know, I have spent almost 40 years being fascinated with bone, fascinated because the body is an extremely intelligent organism, and there's so much we can learn from the body, and it's certainly not a big task to create healthy bones when one single liver cell can do 1 million biochemical reactions a second. The body is very intelligent, and to help the body, we need to understand what we're doing that actually might be of detriment to bone. So my suggestion to this member in our audience who really wants to know what's going on with her bone is that she should step up to the plate and learn about her bone health. And of course, I have developed a course. My team has developed this Better Bone Solution. It is an 18 video course. We give this course in person many places, like at the Kripalu Yoga Center and Art of Living and Omega and all these places. We're happy to do that once or twice a year, but we've also made it an at-home program. So you can get this binder, you can get those 18 videos, you can get all the written material on each of the 6 steps of the Better Bone Solution that we put in here, because as the woman questions what's going on, she needs to understand what is happening really with her bone health, what her real risk of fracture, what the change in the bone density really was, and what are the signs and symptoms that she really needs. She needs to be very aggressive with her bone health, and then a step-by-step program to implement a natural way to enhance bone density. And even if in the end you said, look, I've had many fractures, the doctors can't do anything about it, I'm going to use the drug, then still you want to do every step of the Better Bone Solution. Every one of the 6 steps you still want to do, because you want to give the body every chance you can have to build strong bones. And remember, everything you do for bone and everything you learn about bone is going to be good for your entire body. So that's what I'd say. Put some work in this and find out on what is really happening with your bone health, and find out the proven natural means to build bone health. And if you want to add bone drugs to it, that's certainly an option that you can have. And later, a bit later in this question and answer, I will talk about bone drugs because someone asks how much bone drugs actually prevent hip fractures. So we're going to go over that in a little bit. There's a big misunderstanding, and the public is being somewhat deceived about the amount of potential that these drugs have to reduce fracture. That being said, there is a place for bone drugs, but the most important thing is to take charge and develop a natural program for bone that will build overall body strength. And then you can decide if you want to do any additional therapies on top of that. So the next question, I'm just going to start in the order these questions were submitted. There's a question about using magnesium for leg cramps. And indeed, nocturnal leg cramps are really troublesome. You know, we often wake up, we often find that we can't sleep well. It's really a very problematic thing. And also it indicates severe magnesium deficiency, which you're getting like a spasm, a cramp in your leg. You could get a spasm or cramp in your arteries, which is a whole nother situation and a very dangerous situation. So you want to correct the nocturnal leg cramps. And the first thing to try is magnesium. And this client writes that they're using magnesium bisglycinate with magnesium oxide. Now, the bisglycinate is an interesting form of magnesium. Magnesium oxide is a poor quality magnesium, not very well absorbed. And they're also, in that combination, is dimag malate and thioronate. So several different forms of magnesium. And that's a good approach. What we do, however, is we used a very select form of 3 different magnesiums, a citrate, an ascorbate, and a glycinate. And the reason you use different forms of magnesium, like this client experienced, is because you absorb one maybe better than the other. It's a little difficult to get magnesium into the cell. And so if you take a couple different forms, you're often able to get better absorption. And indeed, she reports that this corrected her leg cramps and her nocturnal leg cramps. And that she wants to know is if we have any product that will really help them. And of course, we use the Magnesium Plus product, which is those 3 different alkalizing forms of magnesium. Yes, take care. If you have nocturnal leg cramps or you have leg cramps at night of any amount, you know that you really should try magnesium. Some people, if they're very low in calcium, add a little of that. And of course, potassium also helps to correct those nocturnal leg cramps. Magnesium is perhaps the most underappreciated bone building nutrient. And it also, I would say, is considered to be one of the major drivers behind cardiovascular disease. So we're really on board paying attention if we get nocturnal leg cramps, or if we find we're getting spasms or twitches or other signs of magnesium deficiency. Another individual writes about B12. They said, my B12 level is 512. Is that low? And she mentions that she takes 500 micrograms of B12 a week. Well, the 512 reading on B12, that is serum B12, the B12 that's found in the blood, that is sort of mid-range for what the government says is adequate. We prefer a higher level. We prefer a level maybe of 1,000, which is at the more high end, because we're paying attention to optimum levels, not just levels where you tend to find an absence of deficiency diseases. B12 deficiency is very serious. It affects cognitive function. It affects energy production. It affects many things. So you want to have a good B12 level. I prefer 1,000 reading. And just know also that if you have high homocysteine, you want to pay special attention to make sure that you have adequate B12. And there is a better test for B12, which is methylmalonic acid. That is actually a functional test for B12. It asks, and it shows whether the functions of B12 are actually being done in the body. And so you can get methylmalonic acid test for B12. For B12 adequacy, you can get it in the serum, but even the urine test, methylmalonic acid urine test, is slightly better. It's a 24-hour collection, and it gives you the early signs of B12 inadequacy. So I would have more than 500. I have 1,000, and I'd also consider methylmalonic acid if I thought my B12 is not really right. So I want the most precise level I can get. And your doctor, whether they ordered the serum or urine methylmalonic acid is maybe up to them. They might even not even know there's a urine one, but a very good marker of B12 inadequacy is methylmalonic acid. The next question is, my question is, oh, this is an interesting question. My question is, can you reverse or cure osteoporosis with a change of attitude and relaxation, or is the damage permanent? I have always been aware of the mind-body connection, but haven't come across this one. Very early on when I began working with osteoporosis, I realized that the mind-body connection is very important. And specifically, I realized that stress not only increased cortisol, which is damaging to bone, but also not only impaired immunity, and not only caused a loss of minerals, but actually set the whole body to be a little bit ajar, a little bit out of ease. And in fact, disease is dis-ease. You want to have a smooth functioning nervous system. And so indeed, the mind-body connection is very important. Now, and in the Better Bone Solution, again, our course, the Better Bone Solution, the 6-step course, we pay a lot of attention to stress and creating resilience. And so this very point of change of attitude, it's really kind of interesting what we think we become. You really want to check into what your beliefs are and what you're talking to yourself about, because that very important internal dialogue is terrifically influencing on the chemistry. You're like talking to your body when you say, oh, I can't possibly eat 5 cups of vegetables a day. Then you're already saying that's an impossibility. So, or to think, oh, I cannot do this exercise. And I can't do any exercise, or I don't like exercise. You're already limiting your possibilities. So the mind-body connection, the attitude connection is really important. And if you're interested in exploring that, take the course with us either in person or do it online. Oh, I would mention in the online course, we are now meeting once a month, and we're going, everyone taking the course is offered to get together for a free session. And we do a Zoom and we cover several topics, or at least 1 or 2 steps of the program in every single one of those sessions. And also that gives some continuity to this masterclass, because we're talking about changing our attitudes as well as the way we eat, as well as our exercise patterns. We're talking about moving to a more life-supporting overall approach. And so, yeah, we definitely highlight the connection to attitude, to stress, and to developing a sense of ease and a sense of comfort, so that the body can easily do its uncounted tasks without friction and without stress. The next question is, what do I think about Esther C? Well, Esther C is a new kind of a synthetic combination of, they take ascorbic acid and they add some calcium ascorbate, and they were trying to find something. I believe one of the major approaches that it was not so hard on the stomach as ascorbic acid. For decades, decades and decades, we've known the power of ascorbic acid. That's what we often think of as vitamin C. And if you go to Alkaline for Life, you'll find I've written many blogs there, and you'll see some early reports of the use of vitamin C where they actually were able to heal things like polio and hepatitis and many all kinds of infections with high dose ascorbate. High dose vitamin C is what they used in the old days as ascorbic acid. Ascorbic acid is acid tasting. It's tough on the stomach. So Esther C was developed as more easy on the stomach. And there is some advertising that says Esther C is more highly absorbed, but looking very carefully at those studies, I don't see that it's necessarily true. What we use is an easy on the stomach, fully buffered, fully reduced ascorbate. And that is a type of vitamin C that has the minerals attached to it, some calcium, magnesium, zinc, potassium, very easy onto the stomach. It alkalizes, and it's extremely potent. When we say it's fully reduced, it means that the vitamin C that we produce, the alkalinity C we talk about, has all of its electrons in place. Vitamin C is an antioxidant because it's an electron donor. It donates electrons to quench free radical damage, to serve as an antioxidant. Much of the vitamin C you buy on the shelves already has given away its electrons. It's already oxidized. So in my practice, I generally, I only look for the best products because we have very serious individuals who want to fully recover health, and they're making a big effort. And in my own health, I would only use a fully buffered, fully reduced ascorbate like the alkalinity C, and that's what I suggest. In my mind, Esther C is really secondary, a new kind of invention to try to make ascorbic acid easy on the stomach. But nothing, and it's all apparently the way the way the Esther C is processed, it's already a little bit oxidized, produces certain metabolites that are oxidized. I'm not a big fan of Esther C. Okay, that's because I only want the best. I mean, if you're using it and you like it, fine, but it's that you could notch it up a little. Okie doke. Then this next question is, did anyone retake a DEXA scan because they were dehydrated? Interesting question. My scores came back very low, and I'm wondering if I should get it redone. Well, there's a lot of things that affect the DEXA scan, the bone density scan by DEXA, that's by radiation. And one minor one is hydration, because that the DEXA scan is influenced by the soft tissue. The radiation has to go through the soft tissue. And so if you're dehydrated, the soft tissue is going to be a little different than in the soft tissue of a person who's well hydrated. And of course, those machines are based on all these computer calculations of like what the average person, what their hydration is, for example. So I looked up the data, and it can be, if a person is very hydrated, it can make their bone density look worse. There's many things that can make the bone density look strange to you. For example, the position on the machine, or the machine might not be calibrated right, or there might be another technical problem with it. There's many concerns with bone density testing. In fact, 90% of the tests, the bone density tests by DEXA, have errors. This is recent research, and that same research shows that 50% of those errors are significant enough to affect the treatment plan. So we always take the bone density with a grain of salt, and it's good to say, hey, was this done right? Hydration is not the first place I look, but if you thought you were extremely dehydrated, you can do the test over again. Maybe the message to all of us is to be careful with hydration. We're 75% water. We need to keep the fluid in our body and the fluid within our cells. And that's why we like to drink a slightly alkaline water. That's what we take, the buffered vitamin C, put it in some water, a little bit of vitamin C, half a teaspoon, quarter teaspoon, drink it, 2 or 3 glasses of water. Very good idea. So yeah, I mean, you could retest. I don't think it's the major cause, but it does seem to be possible that hydration would affect the bone density, the DEXA bone density. The second one is, or the next question is, my endocrinologist told me I have severe osteoporosis, and I am borderline with, so my endocrinologist told me I have severe osteoporosis. So, osteoporosis is really defined by bones so weak that they fracture needlessly. So this woman reports she hasn't fractured. So frankly, I would not say she has severe osteoporosis. In fact, I would totally reject that title of them telling me that I had severe osteoporosis because my bone density was low and I never fractured. This is a question, and I've spoken to you all about this before. In the last 40 years, they've redefined osteoporosis by bone density test, but it hasn't worked out. Now they know after 40 years using these machines that you cannot predict fracture by bone density test. 50 to 70, even 80% of the fractures occur in people who have just osteopenia or even normal bone density. So it's more complicated. As far as bone density goes by DEXA, I would say it was a good try, but it did not work out. So to this person, I would say first, don't take on the diagnosis of a disease without really good proof that you got that disease. And the only proof of osteoporosis, that one of the major proofs is needless fracture. And this person has had no fracture, but the doctor said she had severe osteoporosis with that's by DEXA. And she had a REMS. Now, your REMS, you might have heard me talk about REMS. It's a new Italian system of trying to measure bone strength. And they're actually also trying to measure bone density by ultrasound. It's not radiation. They put a sound wave into bone. They see what comes back. They have studied to see what sound wave comes back from stronger bones and what sound waves come back from bones that are fractured. And so the REMS is a very interesting new technology that tries to detect the strength of the bone, the actual strength. And so the REMS offers a bone density and a standard bone density measurement, but more importantly, it offers a fracture index. So this person says, my REMS is good. So we got to presume her bone density was fairly good. While on the DEXA, it was really poor. On the REMS, it was better. And we got to presume that her fragility was better. I do like the REMS. We use it a lot. And in fact, when we give our courses, like at Kerpalo, and when we go to Omega and all this, we'll have the experts come with their REMS testing machines, and the people that want to have that test can do it. It's many times relieves the worry, because you see another system saying, look, this is not as serious as you said. Your bones aren't as weak as you've been told. You already know maybe they're not that weak because you haven't fractured, but nonetheless, so she wants to know, how do you make it that the DEXA says she is severe osteoporosis, the REMS says she's got stronger bones? Well, that just goes to show you that we do not really know. All these machines to what they call diagnose osteoporosis and measure bone strength are really works in progress. In other words, they tried 40 years with the DEXA. It's not looking too good. The accuracy of that, or the ability to predict fracture with that, in my mind, that's my mind from looking at the research and spending 40 years working with this. And on the other hand, REMS, a new Italian technology based on ultrasound that tries to develop a fragility index. What I like about REMS is the fragility index. So if this individual says, hey, my REMS said my fragility was quite low, then I would be very pleased with that. And I'll tell you one other thing. If you're confused about judging your bone strength, you pay attention to a couple things. You pay attention to receding gums. How much receding gums do I have? What does the dentist say? Is it kind of stable, or are you having a lot of receding gums? You also pay attention to things like grip strength. It's very clear that the strength of the grip strength reflects the spine of the strength of the spine, and you pay attention to muscle mass. It's also very clear that bones and muscles are one single unit, such a simple thing. And when you find really relatively strong muscles, and we're talking about strong muscles for your age, you're going to find stronger bones. And when you find weaker muscles, you're going to find weaker bones. So I would put the signs and symptoms of osteoporosis, of bone weakness, as far as your dental structure. Teeth are the strongest bone in the body. I would watch and see what happens with how those teeth are in place. If there's bleeding gums, if there's receding gums, if there's periodontal disease and loss of jawbone strength. In Europe, they take x-rays of the molars, and they tell you about the strength of the bone. So you look at the strength of the muscle also, your own self-assessment. And here's something if you don't know it, you should know. The average person loses 45% of both their bone and their muscle as they go from 35 to 85. So we all are going to lose bone, and we all are going to lose muscle. But the trick is to maintain ourselves as structurally and functionally strong as we can be. And so this is why the Better Bone Solution says we should do things for bone that are good for the entire body, because bone is just a part of the fabric of this whole amazing machine that we have. You want to keep the whole machine working well and in balance. Muscle strength is a very good indicator of bone strength. And it's a challenge for all of us, including me, to maintain muscle strength as we age. So have fun with it. Find exercise you love. Maintain your muscle strength as best you can. And perhaps worry less about the bone densities. The next thing is if you take D3 with vitamin K2, and that's kind of a new fad. You know, we know that vitamin D and vitamin K are both important and both underconsumed, so they tend to put them together. You buy a pill that's got vitamin D and K2 in it. Vitamin K2, MK7, is the form of vitamin K that's produced by bacteria that's particularly helpful. So helpful to bone. So they put vitamin K together with vitamin D. And that's okay, but people need different levels of vitamin D. It's amazing. I test vitamin D with individuals, thousands of individuals, and there's very different needs. Some people need 1,000, 2,000. Some people need 5,000, 6,000 to get the same, say, let's 50, 60 Ng level. So always test your vitamin D. Always find out how much you yourself need. But this person asked, if you take D3 with K2, would adding quercetin potentially cause too much blood thinning as a side effect? Now, that's because this person suggests that vitamin K2 is blood thinning. Well, vitamin K is an important nutrient. It's not going to really cause excessive blood thinning. Quercetin is an important nutrient, and this person brings this question up because they know I'm a great fan of quercetin. I really see a very pure quercetin dehydrate with OPC and pomegranate have been shown over decades to be such a powerful antioxidant, anti-inflammatory, such a powerful repair agent. So this person wonders, hey, I'm taking my D, I'm taking my K, my K2 is, and that's always going to be in a small dose, the K2. And then is it any problem to add quercetin? Well, what happens in the average healthy person, it's certainly not a problem. If you had a blood thinning disorder, or you had some sort of you're on a blood thinning medication or something, we could look at that in a little more detail. But quercetin has a slight impact to keep the platelets from sticking together, which is a very good thing. But it's a very mild blood thinning effect. It has a very mild blood thinning effect, and so it isn't a concern really for the healthy person that's not on drugs like bone platelet blood thinning drugs, for example, or daily aspirins or things like that. That maybe it's not a good idea to get too many of those together, too many blood thinning effects. I certainly find quercetin to be very effective on many fronts, and you just be careful if you're taking a lot of other medications, or you've been told you have a blood disorder. There's a comment here on, she says, I'm getting pressured to do meds. I presume it's bone meds, but really cannot fully grasp the risk or benefit of whether studies have shown decreased hip fractures after age 80 on the population who took those versus those who didn't. That's a very astute question. And what happens is, in most of the trials, they exclude people who are 80 and over. The average age of death in this country is about 81 for women. And so I guess they don't look at older women in these trials. It could possibly be because there's very little benefit for older individuals. A more thoughtful doctors will say, well, let's project how long this person is going to live, and let's project their overall strength, and let's project their risk of fracture. Is it going to really make a difference? I did find a few studies, and basically there isn't much data on people 80 and over, but the benefit, there may be some benefit from bone drugs in hip fracture reduction, but it's very slight. And in fact, the one study that I did see we were able to put together was that in patients 80 and over, there was the absolute risk reduction. Now, this is something really important you should understand. When they talk about fracture risk reduction, they can say, there's a 30, 40, 50% fracture reduction, but that's the relative fracture risk reduction. So if you study 100 people that don't take the drug and 100 people that take the drug, if 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 you get even a tiny reduction taking the drugs, like if one person fractures in one group and two people fracture in the other, they can call that a 50% fracture reduction. You want to find out the absolute fracture reduction, and that is equivalent to the number needed to treat. So the question to ask your doctor is, hey, I'm an 80-year-old. What does the data show about giving an 80-year-old? And it's important to say whether you have fractured or whether you haven't fractured. There's no doubt that bone drugs will be a more benefit to people who have already fractured and are at a higher risk of another fracture. And what they find is that the data, they'll say, well, it's a 20 to 40% fracture reduction. And when you look at what that means, it means that it's 1 to 2% a year. You have to treat 100 people for 3 years to prevent 1 or 2 hip fractures in people 80 and over. So you just calculate that. You say, is there anything else I could do to make my odds better that won't have any of these side effects? 1 or 2% reduction means 100 people have to be treated to prevent 1 or 2 hip fractures every year with these drugs in people over 80, and you have to be treated for 3 years. So the studies actually say, calculate, is the person going to live for 3 years more? Many of us are going to have nice long lives. So we want to stay as healthy as we can. So just learn how to understand these studies. It's pretty weak. The data is pretty weak on older individuals, but you want to know the individual case. If you haven't fractured, I'd say, nah, it's pretty hard. Do many other things. Do your exercise. Do the Better Bone Solution program. Improve your whole body. And if you have multiple fractures, then you might say, well, maybe I'll be that 1 out of 100 or that 2 out of 100 that hip fracture was prevented. One of the easiest ways they detected hip fracture risk was how long, if you can stand on one leg. Hip fractures occur because of falls. So the trick is to figure, how can I work on my balance? So I right away go to these physical therapists who are working with balance. Practice, pay attention to balance. When you talk about hip fractures, we have to remember they occur because of falls. Falls because of many things, but poor balance is one, rushing around too much, and muscle weakness. Physical therapy should be our best friend as we get older because we tend to lose muscle mass, and maybe we lose a little bit of our motivation to do exercise. But maintaining muscle and strength is one great way to prevent hip fractures. Okay, so let's look at what else we've got here. Just a couple more questions. This next one is, why does my stomach hurt very bad when I eat kefir? Isn't that supposed to be good for me? Well, it really reminds us that, one person's goodness is another person's poison. It really depends on our digestive strength. Like many people, you could be allergic, like you could have a reaction to dairy, or you could have a problem with dairy that could cause that with kefir. Or more likely, you could have a problem with your intestinal bacteria, that many people with small intestinal bacterial overgrowth, with too much where the bacteria gets in the small intestine instead of being in the large intestine and causes a lot of bloating, a lot of gas, a lot of problems, they're worse when they take a probiotic. So it could be part of that. The byline here is, I wouldn't stress out about why. I would say, hey, look, I think I better not take kefir now. And then you can do some research and find out, what the heck, what could this kefir, you can do some queries. Artificial intelligence now, ChatGPT has an amazing amount of information. Even Google has picked up artificial intelligence. So you could ask your question, but just say, hey, it's not working for me. So I want to see, is it to do with my intestinal bacteria, or is it something with the dairy itself that's giving me a problem? And you can test any food by just taking a small amount of it. And if a small amount of it bothers you, then you know it's a more stronger reaction. Is beef bad if having autoimmune disorder? Well, it's not that beef is inherently bad. I mean, it's bad for the cow, but so it doesn't mean that it's a bad food, but it's a food that actually causes a lot of inflammation if you take too much of it. And so I would say if you protein is very important. Protein is important for immunity. So you might say, let me get protein that's not so acid forming, which beef is, and uh, not so concentrated. Like the plant proteins are very good. The beans, all sorts of beans. And I'm starting to publish some little booklets on protein combining where you can get high protein but low acid food. That's very important for bone health, not to have too much acid created in the body. So beef is fine once in a while. The real thing about autoimmune disease is that you are leaking proteins through the gut. The digestion goes on. Some proteins are not well digested. They're leaking through the gut, and they're getting past the lymph glands, the lymph nodes, which want to absorb that. The lymph nodes are too full. They say, let's go on, get into the blood. And when those proteins get into the blood, then the white blood cells see them as foreign invaders and they attack that protein. They cause a lot of inflammation, and often the immune system gets a little confused and starts attacking the body like it were that antigen that leaked through the gut. So testing for food sensitivities is very important in autoimmune disease. And remember, there is such a thing as delayed reactions. If every time you eat beef, for example, you say, I get a headache, I get hives, I get an immediate reaction, then you know that the immune system is responding. But 80% of all reactions in autoimmune disease are delayed. They can take up to 4 days to a week. And so you'd have to be off beef for a week, say. And then you have a little serving of beef all by itself, and you say, are any of my symptoms worse? And one of the tricks is to rotate your food, not to use a lot of beef. Get your fish, chicken, turkey, your beans, your plant protein. But per se, beef isn't bad. It's just that we wouldn't want to eat too much of it, and you don't want to eat it if it's leaking through the gut and your immune system recognize it as a foreign invader. I hope that helps. I've done a lot of work with autoimmune disease. Seems like there's a lot more autoimmune diseases today. It's partly because we got a lot more leaky gut. We take drugs and medications, nutritional deficiencies that cause the gut lining to be porous, and things leak through it. If you're interested, I prepared a little course on leaky gut. We have a great remedy for leaky gut, which is a special glutamine product called Glutamine Pack. If you're interested, we'll try to do a little webinar on that leaky gut. That's a really interesting question. And when you see autoimmune disease, that's proof of leaky gut. And when you see it's food allergies, it's proof of leaky gut. Every time I take magnesium before bedtime or in the evening, I become restless, energetic, and can't sleep at all. And she says, no one can help me. That's a really interesting question, because the first thing when a person says, I'm not sleeping well, we say, take magnesium. I personally take magnesium at night. It's really great. But there is a small percentage of people where it seems to be that magnesium can have an adverse reaction, and it partly has to do with the mitochondrial energy production. It's a little bit complicated chemistry there, but the situation is to try first a nice using some B vitamins, like the thiamine seems to be part of that pathway, and then we'd say try to use these best forms of magnesium, like our Magnesium Plus, which is magnesium glycinate, magnesium citrate, and magnesium ascorbate. And then you might have to do a work around that because there does seem to be that thiamine, this B1, has been found to help some people with that rather unusual situation that magnesium causes them to be instead of bringing about relaxation, it causes some agitation. And of course, our multivitamin, the Energized Multi, has a nice amount of B1 in it, but you want to take that earlier in the day. You don't want to take it at bedtime with your magnesium, because that multivitamin can energize you. So you take that earlier in the day. You get your B vitamins. If it doesn't work, maybe try some other B vitamins, more concentrated forms of thiamine, to see if you can absorb it. And then if it helps with that reaction with the magnesium. What's the best way of checking bone density? Well, like I mentioned, There's the DEXA, which is the standard now, and then the Italian device, the REMS, the echo light machine, the ultrasound system is coming, is here in a few centers in the US. So that's another good way. Wherever you go, whatever, those are the two systems right now for bone density. Now, neither of them really measure bone density, but they try to calculate bone density in a certain sense. They're not direct measures of bone density, but that's kind of a technical question. So know that you want to follow a few guidelines. Always go to someone to a place that's very good. If you're going to DEXA, make sure the machines are calibrated. Make sure that they've been adjusted. Make sure the technicians know how to place you on the machine. The best is to go to a big hospital where they have a good, well-trained staff, if possible. And the same thing with the echo light. We really encourage people to go, if possible, to see Dr. Zambito and Dr. Bush. Those are the two doctors in this country, both orthopedic surgeons, who brought this device here to introduce it to the public. So, I mean, who became the leaders in studying it and teaching it to the public, and at least have them help interpret your tests, because it's you always want to go to the most skilled people for the testing and for the interpretation, because there's a lot of variation can happen with that. And remember my byline, bone strength relates to total fitness. If you say, I'm feeling great, I'm energetic, I can be active all day, I can do my exercise, and my muscles are holding up well, even though you're a small person, you want to keep those muscles strong. And remember that bone density testing by DEXA is very influenced by bone size. So small people with small bones or thin people are going to get lower readings. That's where the echo light really helps. If you're a thin person or you have small bones, you're going to get much better and much more enjoyable readings on the echo light, because it is not affected by bone size. Okay, how much relief and repair and how much vitamin C for allergies? That's a really great question. And some of you might have heard my story. Like, I had a terrific amount of allergies when I was in graduate school for anthropology. I'm originally an anthropologist. That's why I'm interested in all these cross-cultural issues. And well, we see that this allergy has to do with a weakening of the immune system and a weakening of the protective barriers, the barriers particularly in the gut, that allow proteins to get into the circulation, and then the white blood cells really attack these foreign proteins. So the vitamin C, and what does the body do when a protein leaks and gets into the blood? It creates histamine. Histamine is an inflammatory substance that tries to dilute down that damage that's coming to the body. And so vitamin C is a great natural antihistamine. And the second, and perhaps the most powerful natural antihistamine, is quercetin. That's why we use a really elegant, purified form of quercetin dehydrate made from one single plant, this Saphoretica panica, a very specialized plant that's high in quercetin. And we use it's combined with pomegranate and OPC to make a very complete antioxidant antihistamine. You got ascorbate, a high quality vitamin C, not a vitamin C that's already oxidized. The vitamin C we would use is packed under nitrogen. You have to treat it very carefully. You got to shut that bottle really tight. You never put a wet spoon in it, because it will definitely oxidize. So you want to take the vitamin C, I would say, to take you start out with, if you have serious allergies, start with a teaspoon 3 times a day. If you get too much vitamin C or you're not used to it, you might get a little loose stool. But basically, I start with a teaspoon 3 times a day. Put a little warm water, a little room temperature water, slightly warm, or cold water if you like. And then, a half a teaspoon, if you're cautious, or a teaspoon of the buffered ascorbate, 3, 4, 5 times a day. And the quercetin dehydrate, what we call relieve and repair, 1,000 milligrams of quercetin, very potent, maybe once or twice. Some people take it 3 or 4 times a day. There's never a need to take it more than 6 times a day, because the benefit will be achieved before that. But even a few a day, it depends totally on the amount of allergy, but do this experiment. Take a teaspoon of vitamin C, take 1 quercetin. Most people will see an improvement within an hour. And then you say, okay, then maybe 3 or 4 hours, you take another one. And maybe you take 3 doses of this. Teaspoon of vitamin C, 1 of the repair and relieve. You do that 3 times a day. That's you'll notice the benefit, and you maybe begin to figure out, gee, what am I really reacting to, and try to limit exposure. Let me just see. There's a couple questions that just came in now, and let me just see my last couple questions on this list. Here's the last question on the last typed in question. I have a bleeding disorder, so quercetin gives me a nosebleed. Can you suggest an alternative? Well, yeah, there's many. A bleeding disorder is kind of an interesting thing. There's many types of them, so I'd certainly just do whatever the doctors say. If quercetin gives you a nosebleed, like quercetin is not a strong blood thinner, but anyway, if it gives you that problem, don't use it, of course. And then I would just stick with the vitamin C. And remember, for allergies, nettles tea. Nettles is a wild plant that's out there, stinging nettles, but that stuff is terrific. And in fact, Susan Weed, a very famous herbalist, would have you take a handful of that stuff, put it in a quart bowl jar. Maybe you put a half a cup, fill that thing with water, and let it sit for 2 or 3 hours. It'll turn into what she calls the green goddess. And you drink that tea during the day, a few cups of it. Nettles is very great for allergy. You might give that a try, along with your vitamin C. Now, let's see what else people wanted to know. They just called in these questions. Now, how do you feel about strontium citrate for bone health? Well, let's start right at the top. Strontium is a mineral. It's very close to calcium on the periodic table, and it actually can be beneficial for bone in very small amounts. Like we use, I think it is just 50 milligrams in the alkalizing minerals, which is our bone formula in the alkaline for life bone formula. So there's 50 milligrams there. Dietarily, strontium, we get maybe five milligrams, maybe a little bit more than that. There's strontium in water. There's a little tiny bit in food. So strontium is in the environment. It's a natural mineral. It can help. And because they recognized decades ago it could help in small doses, just like magnesium, manganese, zinc, and copper, these trace minerals, particularly zinc, copper boron trace minerals that they discovered, wow, these affect bone. So they noticed with strontium. And so they originally started using maybe 200 milligrams, 300 milligrams, and they saw some benefit. And then a drug company decided, let's develop high dose strontium. So they made a synthetic strontium, 650 milligrams of strontium relenate, which is strontium combined to rulenic acid. Now, this person is asking about strontium citrate. I'll get there, but let me tell you the whole story. So they made a drug. And I met these researchers. I talked with these researchers at the conference. One of them was a good friend of mine, actually. And they found that, yeah, this high-dose strontium was a drug that helped bone. But then several years later, they found that it was quite damaging to the heart, other risk factors, so it was almost taken off the market. Now, in countries like the US, the drug strontium is not sold. And in Europe, it's really recommended. It's almost taken off the market because of the secondary effects, the harmful effects, although it did perhaps really reduce fracture in the studies. So people are saying, well, let's use strontium in not small doses, not like a dietary dose and a little better, which is what we use in the alkalizing minerals. But they said, let's use high dose strontium. Let's use just what they used in the drug, which is like 650 milligrams. And this is what you find. Strontium citrate was developed, and it's allowed to be sold in this country. And it's a pharmacological dose. It's a very high dose strontium. There's nothing natural about it. It's a dose of strontium you never ever see in any kind of real life situation. And so it's developed here in the country. It has been not studied for fracture prevention capacity, although I don't doubt that it has some. It has been studied for the fact that this strontium deposits in the bone, so it makes the bone look much stronger, and much stronger than it actually is. And I forget the calculation, whether it's 50% that it looks stronger when it really isn't. But you take strontium, your bone density will definitely increase. You stop strontium and your bone density goes back down because the strontium is stored in the bones. When you stop taking it, it's released from the bones and the bones no longer look strong, and any degree of benefit is lost. So I guess what I'd say about strontium is if a client of mine has done everything they can, they've done every step of the Better Bone solution. They've taken care of their eating, they've alkalized the diet, they've looked for medical causes of bone loss, they developed a wonderful exercise program, and they even studied their digestion to try to figure out how can we optimize digestion. If they've done everything and they say, I can't figure it out, I'm still losing bone too much, and I might have even fractured, then your question is this better than the drugs the doctor than the drugs that are approved in the US? This is a drug dose product, but it's not considered a drug, although it is a pharmacological dose. And unfortunately, there's been no studies on strontium, long-term safety of strontium. It's going to tax the kidney a little because it's a lot of strontium you're putting through the system. Unusual and very unnatural amount of strontium. So if you do use strontium citrate, I'd say watch, it's another one of these drugs or these substances akin to the drugs that they test the success of it by how much it reduces bone breakdown. So if you get your CTX or your NTX bone breakdown markers, and you say, look, it's always run away, I can't correct it. And you're concerned about it because your bone breakdown is higher than your bone formation, which they should always be measured together because they usually are quite on a par. This we can talk about in the course. It's a little more complicated, but here to know, sometimes people can take very low dose strontium citrate, like 200 milligrams or 300 milligrams, not to take the 650 that is often given. We at the Center for Better Bones, we encourage natural programs to enliven the body's natural intelligence. When you throw something in the system that's not physiological, you're going to throw certain things off. But our medicine's based on that, and often we're in a tough spot, and so we're trying to do something quite dramatic. We always say we work with nature, but if you're thinking of strontium, try to make sure you responsibly do everything else that supports the body every step of the Better Bones evolution, and then you say, okay, well, or I just want to do a shortcut. Do the lowest dose possible you can get to see the results, and just know that the minute you stop that, your bone densities are going to go right back down. Okay, so just two more questions people wrote in, and it's really fun. I'm glad you joined me. It's kind of fun for me to see what people are thinking about and to see what the new research is. There's a terrific amount of new research all the time. We'll try to do this once in a while to get updated, and you can tell me what you want to know about. So this question is, what are the best exercises for osteoporosis? How about resistance bands? Okay, so real simply, the best exercises for osteoporosis, I put them in a couple categories. One is anything that prevents falls. So if you say, I can do squats, I'm building my lower body strength, I'm doing exercises for balance and dizziness, you yourself judge, or you go to a physical therapist and you figure out where you're strong, where you're weak. We want to prevent falls. You need good lower body strength. You need good balance. So we'll work on that. The next thing is you want to build muscle. Anything that builds muscle builds bone. And that makes sense. It's the muscle, it's the tendons pulling on the bones that causes the bones to bend. And when bones bend, even a tiny bit, it sends a signal, a piezoelectric, an electric signal to the bone building cells to start working and to build bone strength. So you want to bend the bone. So you want to put unusual weight on the bone. That's why the weightlifting is very helpful. If a simple byline is if you're building muscle, you're building bone, and you want to do that with good supervision. Belinda Beck, the Australian Bone Clinic, I interviewed her for 20 years. She studied strength training for osteoporosis. She's got 65-year-old building 10% of bone mass with strength training, like Olympic weightlifting, deadlifts, squats, all this sort of stuff. So if you're interested in that, you can look at the blog. The blog on betterbones.com, which is how Cindy built so much bone. And it's one of my clients who actually called Belinda Beck about 10 years ago, before Belinda was so famous. Belinda talked with her, and she figured out the exercises that Belinda used at the Australian Bone Clinic. And her son was a trainer. She did all these exercises under careful supervision, built a lot of bone. I've seen many clients. Whenever I see a client build bone and their it's mostly all related to exercise, unless they're doing a drug that affects it. So this person asks, is stretch bands? Well, stretch bands are helpful. Stretch bands are helpful, sure. I mean, anything that causes the tendon to pull on the bone. Stretch bands were helpful. So that maybe is a good place to start. But you want to probably do more than that. It's good to stay flexible, but you want to build strength. So even if you say, well, I like yoga, that's fine too, but work up to doing it more thoroughly, more intently. So you're actually building muscle. A great way to start for the average person is to go to a physical therapist and say, look, I want to get stronger. Measure me and see, where am I weak? Is my lower back weak? Are my shoulders weak? Are my legs weak? And they'll set you up on a strength training program. If you build the strength of the spine, if you build the muscles that attach to the spine, you're going to build the strength of the spine. If you build the muscles attached to the hip, you're going to build the hip. And so get some professional advice. Don't run off and start doing a bunch of deadlifts, because you don't want to hurt yourself. The other thing is mindful exercises. So you got your things like gentle resistance. You've got stronger resistance. It's actually in the Better Bone Solution. We have a whole categories of exercise and how much to do of each. But these gentle exercises are great because you want the flexibility. And the mindful exercises are also really important, because when you combine breathing with movement and intention, it has a very big calming effect. And remember, I said in the beginning, when the body is calm and at ease, feeling comfortable, you're going to build bone more successfully. There's been several studies with yoga, very nice. Doing it was every day for 5 days a week. These people in India stabilized bone density. Those sessions also included relaxation between each session, included chanting at the end, kind of relaxing the body. And fascinating studies with Qigong, the Chinese system of Qigong, these gentle movements that are coordinated with breath. And there's one really fun Qigong exercise called the 5 frolicking animals. What these ancient people did is they mimicked the movement of the animals. And if you ever looked at a deer or a rabbit or these birds, any animal, you'll see the grace to which they move. And so they developed human exercises where you imagine the movement of this animal or the movement of a bear. The 5 frolicking animals. You'll find some people offering it on the internet. That is a wonderful thing to do. In fact, if you YouTube it, you'll find some people in China in their backyard doing these exercises. It's really very fascinating, and those are very helpful. If you say, look, I'm not going to lift weights, I'm not that strong of a person, do like Tai Chi or Qigong, some yoga, that will be very helpful. There's different exercises for everyone, and basically, if you love resistant bands, do it, but maybe do that and then move to other levels. The last question we have is, my doctor told me I should not eat cruciferous vegetables like spinach and cauliflower. I don't know if spinach is a cruciferous vegetable, but cauliflower, broccoli, Brussels sprouts certainly are. You guys look it up on your AI there. Is spinach considered cruciferous? I don't think so, but maybe it possibly, but because of the oxalates, and it's bad for bone health. Okay, well, in my research, in my experience, I found that the great goddess gave us all this food, and mostly any natural whole food is going to be really great start. Now, there are people who feel they're very sensitive to oxalates, and I think that can happen. And although I don't see it, I see it combined with a whole bunch of other disruptions of the chemistry and a whole bunch of sensitivities. But nonetheless, certainly I would not, if I digested cauliflower well and broccoli well and spinach is certainly, or Brussels sprouts, I wouldn't be worried about the oxalate. If you feel poorly with them, there is a Dr. Gunther who's paid a lot of attention to oxalates, and some people with a lot of joint problem and stuff, they find that they're benefit, and it's simple enough to try. But if I didn't have specific reason to try this oxalate-free diet, I definitely wouldn't do it. I would stick with there's a lot of research on these cruciferous vegetables being very you produce sulforaphane, which is a very powerful antioxidant, a very powerful anti-cancer component. And what happens with those cruciferous, like broccoli, cauliflower, Brussels sprouts, when you cook them, those sulforaphane, the enzymes that converts that sulforaphane into a useful component that sulforaphane is produced from is destroyed. So if you have your broccoli, then just have a little bit of either raw broccoli, or if you cook the broccoli, just eat a little bit raw, or even a radish will be enough to take with that broccoli to potentiate that sulforaphane. That's an important thing to keep in mind, because cooking can affect the sulforaphane production. Great. Well, it's been a lot of fun. Have a great week. We're going to see if we can frequently answer your questions. So if you have other questions, just send them in. We're trying to help everyone build strong bones to stay stronger longer and have a happy, long life. See you later.